All right, so today we're going to finish up like the MCQs. In my first few sections, that took up the whole time. So it'll probably go like, I mean, we'll do the full thing, but just to give you guys a heads up, takes the full time. All right. Let me get my headphones too while you guys are answering. Okay, so like 10 more seconds. Yeah, so regulation of blood glucose, right? That is going to be a function of your digestive system and a function of your endocrine system, mainly of your endocrine system. Okay, like 10 more seconds. Yeah, so the correct answer to this one is actually going to be all except for the tibia. Okay, so infants and children, it's very common to see red bone marrow, right? Their entire skeleton basically is red bone marrow. In adults, you see it really in your axial skeleton. So, like your pelvis, your vertebrae, your skull, places like that, but not in the tibia. Also, my formatting like super well with Engagely this morning in my first section, so I like very quickly reformatted the PowerPoint. So if some of the fonts weird, that's why. Okay, let's do 10 more seconds. Yeah, so the shaft of the bone is going to be called the diaphyseus. Okay, so remember, epi means outer, right? Oh, there's music. No food there. So epi means outer, right? So epiphyseus, you're talking about the outer ends. Endo means inner. It's going to be that inside lining, inside that medullary cavity. Periosteum is going to be that outermost lining. Ugh. Okay, so diaphyseus is going to be the shaft. Okay, like 10 more seconds. Yeah, so the mineral most important for bone strength is going to be calcium. Okay, the rest of these are really important when we talk about other functions in the body, like carrying oxygen in the blood, nervous system signals, stuff like that. But calcium's the most important in bone. Another important one that you're going to see, phosphorus, and vitamin D. Like vitamin D is not really a mineral, it's a vitamin. There's differences, which we'll talk about when we get to 22. But vitamin D is also important for bone strength. Okay, like 10 more seconds. Yeah, so a comminuted fracture is going to be the most common in a car accident. Okay, So with comminuted fractures, what are we seeing with comminuted fractures? Like, what is the, like, I don't know, the marker for it? You can type in chat or you can unmute.
Shattered.
Shattering, right? So
In
with,
pieces.
yeah, shattering into pieces. I think that's what whoever else unmuted was saying.
Yeah, pieces.
So with that shattering, right, you need an extreme amount of force to make that happen. Okay. So that force, right, you're driving along, holding onto your wheel, you hit whatever, another car. Okay. That steering wheel is going to smash into your wrist, and all that force is going to go on the end of your long bones, right? That's not just going to happen from like a sports injury or something. For a comminuted fracture to happen, you need a lot of force. That's why they're most common in car accidents. Okay. With a simple fracture, I think of it as like snapping a chopstick, right? Bone remains aligned. Tissue intact. Okay. Compound fractures. What do you see with compound fractures?
The skin.
Exactly. So that's through the skin. Now with compound fractures, you're at a higher risk for like infection because again, you're going through the skin, right? You're breaking that barrier. So compound fractures are pretty gross, honestly, but they're gnarly. I wouldn't say gross, they're gnarly. Okay. Green stick fractures. Who do we see green stick fractures in?
Children.
Exactly. Children, right? Because their bones are more like bendy. So it's an incomplete fracture. Okay. So in simple fractures, your bone's going to remain aligned, the tissue stays intact. Compound fracture bursts through the skin. Green stick fractures, they happen in kids. It's an incomplete fracture. Comminuted fractures is like the correct answer to this, most common in a car accident, and result in the shattering of that bone. So usually at the ends of the bone. Should be 100% on this one. Okay, let's do like 10 more seconds. Yeah. So green stick fracture, right? Green stick fracture, incomplete fracture. Okay, let's do like 10 more seconds. Yeah, so the main purpose of the vertebral column, support, protect the spinal cord, and allow movement, right? Yes, it does store minerals. Yes, it does produce red blood cells to a certain extent, but those are not the main functions. Okay.
Will support protect the spinal cord and
Support,
what else?
support, protect the spinal cord and allow movement. Okay, like 10 more seconds. Okay. Yeah, so osteoporosis, right? If we break the word down, osteo meaning bone, porosis meaning porous. Okay. A lot of people were getting this confused with osteoarthritis. Okay. Arthritis is affecting the joints. Okay, so arthro means arthritis, or sorry, arthro means joints, itis means inflammation. Okay. So inflammation of the joints, is just arthritis in general. Okay. Now we have two different types that we talked about. We have rheumatoid and osteoarthritis, right? I'm sure I spelled those wrong. Don't judge me. Okay. In this case, though, osteoporosis, so osteo equals bone, porosis, porous. Okay. So like holy bone, like HOLEY, not HOLY. Okay. So holy bone, like meaning that it's been chewed up. Okay, let's do like 10 more seconds. Yeah, so the tibia, right? That is going to be your T-shaped bone at the bottom there. Okay. So T-shaped bone at the bottom here. All right, it is going to bear the most weight in the body. And yes, the question did change. So make sure you read it. Okay, question did change. Okay, 10 more seconds. Yeah, so your femur is going to be that top one there. Okay. Okay, so the top one, that is going to be the longest and strongest bone in your body. Which leaves the last one.
I have a question. On the exam, is it gonna be pictures like this that show like?
So the pictures on the exam, they're not like full body, but they're like, you can see like where on the body it is pretty clearly, if that makes sense. Like if it's a picture of the legs, it's showing like both legs in the lower abdomen. If it's the upper body, it's showing from like the waist up kind of thing. Does that answer your question?
Yes, thank you.
Okay.
I got a question too about piggybacking off of what she just said. Is it like the pictures that you were showing us this past Monday or no?
Yeah. And I'm going to send you guys that PowerPoint tonight. I just figured it would be better to send everything together. So I'm going to send you that and as well as this tonight and the pan open questions that I have at the end.
So it's gonna be like lighted up muscles, like highlighted muscles, and we gotta name it. Okay.
Mm-hmm. There's like 4 pictures. But I'll show you guys, like I have really good examples in like my joints and like muscle questions. Like even though there's only 4 pictures on the exam, right? Knowing the locations of those muscles is going to help you like break down that question. Like if you're getting asked a question about something in the arm and you know that these muscles are in the face or they're in the leg, right? That's going to help you immediately eliminate those answer choices without even knowing anything else about the muscles.
Okay.
Right.
Thank you.
Mm-hmm. So yeah, process of elimination, right? A is going to be your femur. C is going to be your tibia. B is going to be your fibula. Monica, you don't need to answer in chat. Just click on the screen. I typed a message and then you answered again, so I don't know if you saw it, but. Okay, like 10 more seconds. Yeah, so your humerus, upper arm, right? Oh, no. Question did change. Okay, like 10 more seconds. Yeah, so your radius is gonna be B, right? Why is it B and not A?
Because the radius is where the thumb is.
Exactly, it's on the thumb side, right? Which means the ulna is on the other side. Even if you're blanking out on that, you can look for the one that has the wider spot by the wrist, okay? So it has that like triangular shape towards the wrist. Okay, like 10 more seconds. Yeah, so scapula is going to make up your shoulder blades, okay? The clavicle is going to be your collarbone, right? Scapula, wing bones, clavicle, collarbone. Humerus, we already talked about. That's going to be your upper arm. Ribs make up your rib cage. Okay, like 10 more seconds. Yeah, so your mandible, right? So this is an example of how we could ask a question about like the bone without showing you a picture of the bone, right? So which bone makes up your lower jaw? Mandible. This is supposed to say yellow. I realized it in my last class. Makes up your lower back, yellow. Okay. It's supposed to say yellow, not blue. Ignore the blue. I just can't annotate the screen. So okay, like 10 more seconds. Okay. Yeah. So lower back, lumbar. Okay. Lower back, lumbar. When something says it has lumbar support, it's usually like a pillow or something to support that lower back region. Speaking of, I should be sitting upright. Okay. So lumbar. Okay, 10 more seconds. Yeah, so the thoracic vertebrae are going to contain 12, or sorry, yeah, thoracic section is going to contain 12 vertebrae, right? You have 12 ribs, you have one vertebrae for each of those ribs. Okay, like 10 more seconds. Yeah, so the hyoid bone, right? The hyoid bone is like up and in here. Okay, so if you feel for like your Adam's apple, that's actually going to be something called your larynx. The hyoid bone is going to be like up and buried, like behind your tongue, right? Does not articulate with any other bones. Okay, 10 more seconds. Yeah, so your tarsals are going to be found in your ankles, right? Your hands and your ankles have very similar structures, just like a little bit different wording. So carpals, metacarpals, phalanges, right? And your feet, its tarsals make up your ankles, metatarsals make up the palms of your feet, and the phalanges are going to make up your toes. Okay? Okay. 10 more seconds. Yeah. So the bone that's found in your appendicular skeleton, your humerus, right? Appendages, appendicular, okay, humerus. Because humerus is found in your arm is an appendage, right?
So this is kind of a tricky question, right? You're not asking in the whole body. You're just asking in the actual skeleton. All right.
Mm-hmm. Ten more seconds. Yeah. So in your axial skeleton specifically, right? There are 80 bones in your axial skeleton. Okay. 126 in your appendicular, 206 total. Okay. So we're gonna go ahead and do break. I know it's a little bit early, but this is usually like, this is where I've been taking the break with everybody because it's the best stopping point. So let's go ahead and set up the timer. All right, I will see you guys in 10 minutes. All right. So let's get back into it. Oh, wrong one. How did it fall?
You left the door.
I know, I didn't want to lock her out. I wasn't sure if you were.
Let's go. Yes, I know.
She's displeased. It might not be that you can't hear. I just wasn't saying anything yet. So I don't know if you still can hear me. I guess you can, then you can't hear me. All right, 10 more seconds. Yeah. So most of the joints in the body are going to be synovial joints. Those are the ones that have like the capsules and whatnot. Okay. So synovial joints. Okay. 10 more seconds. Yeah. So a ball and socket is going to offer the widest range of motion. Okay. So ball and socket joints. You're going to have two of them in your body. Right. And there's a slide that's like, name where each one of these joints are found. So I'm going to wait to get to that until I write all of them down. Okay. Ten more seconds. right. Okay, so we're like divided between tibialis anterior and gastrocnemius, which is good because both of those are found in the lower leg, right? So that tells you that, well, it tells me that you guys are at least thinking like, okay, it's a muscle in the lower leg, which is good. Okay. Now, tibialis anterior, it says in the name, it's on the anterior aspect of the leg, right? So think about it like the puppet strings, right? When that tibialis anterior contracts, okay, you're pulling up on the top of the puppet strings, which are attached to the top of your foot, okay? And they're going to pull those toes upwards. That is going to cause dorsiflexion. The gastrocnemius, on the other hand, gastrocnemius is found on the back of your calf, right? Those are going to attach to the back of your toes, right? Or sorry, the back of your heel, okay? And when the gastrocnemius contracts, what happens is it pulls up that back of the heel, okay? And your toes point downwards. That is what's going to cause that plantar flexion. So the correct answer to this is going to be gastrocnemius. Okay. Quadriceps and the hamstrings are going to be found in your upper leg. Those are going to have to do with the knee. We have questions on that later. So. Okay, 10 more seconds. Yeah, so fixed joints are bound by fibers. Okay, so think of it about like when you sew things together. I don't know, you sew them together with fibers. Oh, that's very nice. Thank you. So you're like sewing things together, right? I don't really know how else to like make it clear. Cartilage, cartilaginous joints, meaning semi-movable. Okay, so cartilage isn't as stiff as bone is. Okay, so it still has some give to it, but it's not like freely movable joints. Freely movable joints are bound by joint capsules. Okay, let's do like 10 more seconds. Yeah, so movement of synovial joints is going to depend on all of the above. Okay. There's a lot of different things that go into how a joint moves, is basically the point of this.
Good job. If we was to get a question like that on the exam and you only choose half, do you get partial credit?
We don't do select alls for that reason. Because, like, then it's going to be like, because the way that Engagely works, you can, like, you can either give credit if somebody picked one, or you could give credit, or you could take a, like, it's just really hard to, like, grade select multiples. So we don't do them.
Thank you.
Yeah, no worries. Oh, and I did see your email earlier, Jasmine. I have pan open questions at the end. I just saw it while I was teaching my other class, so I forgot to respond to it. But I do have pan open questions at the end.
Okay, thank you. Because I was worried
Mhm.
about that.
I don't know. There's not like a ton of them, but I have like 5 or 6 review questions from pan open. So, all right. So
To
if
read
you're
more now, I don't know, but thank you.
moving away from the midline, okay, that is just going to be abduction. Okay. Adduction would be adding to the midline. So you're bringing things towards the midline. Okay. Internal rotation, you're turning, you're spinning towards the midline. External rotation, spinning away from the midline. Like doing a motion with my arm and you guys can't see. So internal rotation, spinning towards the midline. External rotation, spinning away from the midline, right? Abduction, taking away from the midline. Adduction, adding to the midline. Okay, 10 more seconds. So pointing the toes towards the ceiling, right? So we have flexion and extension, but we don't use those in feet, okay? We use specific types of flexion. We have dorsiflexion and plantar flexion. Dorsiflexion, pointing the toes towards the ceiling. Plantar flexion, pointing the toes down. So you're stepping on plants, okay? So the correct answer to this one, dorsiflexion, pointing those toes upwards. Okay, 10 more seconds. Yeah, so circumduction, right? Take a pen in your hand, draw it. Circumduction. Okay? Internal rotation, you're turning towards the midline. But if I do internal rotation, it doesn't draw a circle. Okay? Okay, like 10 more seconds. Yeah, so spinning towards the midline, internal rotation. Okay? If it just said movement towards the midline, you would be talking about adduction. Okay, let's do like 10 more seconds. So, moving your jaw backwards. I can't do it right now. But the thing that gives you like the double chin, right? That is going to be called retraction. Okay? Moving your jaw forward, protraction, right? So when you are like being proactive about something, you're getting ahead of the game. Okay, protraction, pushing it forward, retraction, pulling it back. Extension, you're increasing the angle. Flexion, decreasing the angle. And then external rotation, we've mentioned a few times. Okay, 10 more seconds. Yeah, so when you turn the soles of your feet in towards each other, right? Inversion. Okay. When they go away from each other, it's the opposite. It's going to be eversion. Okay, like 10 more seconds. Yep. So palms upwards, supination. Palms downwards, pronation. Okay, supination, you're making soup bowls. Okay. Whoa, what just happened? Why did that do that? Sorry about that. 30. Okay, we're pretty close. Ten more seconds. Yeah, so the knee is going to be a hinge joint. Okay. I have in a couple slides like name where each joint is found, so I'm just going to do it on here. Okay. So examples of hinge joints, your knee, like we just said, your elbow, stuff like that. Okay. Hinge joint just allows this back and forth movement. Okay. Ball and socket, there's only two in your body. You have your hip and your shoulder. These are going to have the widest range of motion, right? So, I mean, I can't like stick my hip in my there, but it does swing around a lot more than my elbow does. Pivot joints, good examples of this. You have one in your neck. That allows you to turn your head no. Okay, we didn't learn the specific bones for it, so don't worry about that. The other one, right? So if we look at our arms, right? If we hold our hand here, okay? So the elbow joint consists of the humerus, the radius, and the ulna, right? But this is one joint. Then you have a joint between your radius and your ulna that the humerus is not involved in. That joint allows you to rotate your hand like this, okay? So I'm not moving my elbow at all, just rotating my hand. That is a pivot joint. So that is the radio-ulnar joint. Saddle joint, there's only one. It's at the base of your first metacarpal. That's just a really fancy way of saying your thumb. Okay, so base of your first thumb. All right. And what that joint allows you to do, it allows you to touch the fingertips of your other fingers. Okay, so notice how you can't do that with your other fingers, right? It's because you have one joint down here that allows you to do this. Okay. Condyloid joint, a good example of a condyloid joint at the base of your carpals with your radius here. Okay. It's going to allow you to do some side to side and some back and forth, but it doesn't have as wide of a range of motion as the ball and socket. Okay. So the base of your carpals and your radius. Gliding joint. Gliding joint can be found between your carpals bones, right? So your carpal bones are cube-shaped bones, right? They're going to slide over one another, okay? So that is a gliding joint, okay? A little bit of humor for 5:30 at night, okay? So gliding joints, they glide over one another like this. Okay. All right, so examples of where you can find each type of joint.
Professor Woodruff, for number 14, it is ball and socket, right? Because we didn't do that one.
Let me see what number 14 was. I don't have the numbers on my slide. I have to look at the thing that I made.
It should have been
They
the
don't wanna
question
see-
before this. It should have been the question before this one.
Oh, like what joint is an elbow? It should be
No,
hinge.
No, it say name an example where each kind of joint is found.
Oh, that's what I was listing. So like the hinge joint would be like the elbow and the knee. The ball and socket would be like the shoulder and the hip. There wasn't like a circle one for each, or there wasn't like a circle for that one. That one was more like short answer.
Okay.
Yeah, so the joint most likely to be dislocated, your shoulder. Okay? Because it's a ball and socket joint, but the thing is that the socket part of it is really shallow. Okay, so you have your ball sitting in this socket, but it's very easy for it to like pop out of place, right? In your hip, it is also a ball and socket joint, but that socket is going to be much deeper. So it's harder for the head of the femur to come out of it. So the correct answer to this one is going to be C. All right. Chapter 10, everybody's favorite chapter. Okay, 10 more seconds. Okay. Yeah, so elasticity, right? So elasticity is going to allow it to recoil back to its original length. Okay. So like the example I always use, I hit the desk goes back to its original shape. If I hit a ball of Play-Doh, the ball of Play-Doh is going to stick in that shape after I've hit it. So it has low elasticity, whereas the desk has high elasticity. Okay, 10 more seconds. Yeah, cardiac muscle is going to be found in the heart. Okay, cardiac means heart. Spindle-shaped muscles, that's just another word for the smooth muscles. Okay, so smooth muscles have that spindle appearance. Okay. Okay. Yeah, intercalated discs, right? They're like little snaps in between the heart cells that help stick them together. That's it. Okay, 10 more seconds. Yeah. So skeletal muscle is going to be voluntary, right? So smooth muscle is going to be found in places like your digestive tract, your uterus, your bladder, right? So digestive tract, uterus, bladder, blood vessels, etc. Okay. You do not have to consciously think about making your stomach contract. You don't have to think about like making your blood vessels contract or stuff like that, right? They just kind of happen. Okay, so they are involuntary muscles. Skeletal muscle, on the other hand, skeletal muscle is going to be found attached to your skeleton. Now, with the skeletal muscle, right? If I want to like write something, okay, I can like will my body to do that, right? Like I can decide I want to do something with my skeletal muscle. So skeletal muscle is considered voluntary. Cardiac muscle, again, found in the heart, right? You don't have to think about making your heart beat. So this is also considered an involuntary muscle. Okay. So the correct answer to this one is going to be B, skeletal muscle. Okay, like 10 more seconds. Yeah, so a single muscle cell is called a muscle fiber. This is just straight from your packet, one for one, okay? Muscle cell is called a muscle fiber. Ten more seconds. Yeah, so the sternocleidomastoid. Now with the sternocleidomastoid, the reason why I say like know the pictures well, right? If you're super confused on like what the name of this muscle is, right? You can like do a little bit of process elimination. Okay, so if you know where your frontalis muscle is, it's in the face, right? Zygomaticus, also in the face. You're looking at a picture of the neck. Okay, chances are it's not going to be in the neck. Same thing if you had like quadriceps or hamstrings or something like that, right? You know, those are found in the leg. Okay, so you can eliminate those if you know if you're looking at the picture or you're being asked about a muscle in the neck or something like that, right? And you know the muscles are somewhere else in the body, you can just cross those off. Okay. Jasmine, I saw you were unmuted.
It was a mistake.
Oh, okay, no worries. I just wanted to make sure you didn't have a question.
Yeah, Professor, you know that the pictures are not on this paper, so I was kind of confused, but that is the neck muscle, right?
Yeah, the sternocleidomastoid.
Okay.
I know the pictures like didn't print, and I didn't realize it until I'd already made 100 copies. So, unfortunately, but I'm gonna send you guys like the blank version of this as well as like the answer key with the explanations tonight. Okay, like 10 more seconds. Yeah, so this is going to be your masseter muscle. Okay, your orbicularis oculi. Now your orbicularis oculi is going to be a round muscle found around your eyes. It's going to be responsible for opening and closing your eyes. Oh, I forgot to even start with masseter. Masseter muscle, responsible for chewing. Okay. Your temporalis muscle, you can actually see it on this slide. Temporalis muscle is up here. It's going to wrap down to the inner part of your jaw. It's going to open and close the jaw. Your orbicularis oris is going to be found around your mouth. Okay. It's going to be responsible for like puckering your lips. Okay. Ten more seconds. Yeah, so this is going to be your diaphragm. Okay, so this is your main muscle of respiration. Your intercostals, you have external and internal. Inter means between, costal means ribs. Okay, so whether you're looking at your external or your internal, they should be between the ribs. Okay. Trapezius is going to be found in your upper back here. It's going to be responsible for raising and lowering your shoulder blades.
When we get done, can you go back to chapter 9 to question 14 real quick after?
Question 9, or sorry, chapter 9, question 14. Yep. Here, I can type it out and I'll put it in the chat for you guys. Because, like, the
Thank
multiple choice questions have been going, like, right to the end of class. So I don't know if I'll have time to go back, honestly. But I'll
Right,
just
because
type it out and put it in
that
the chat for you
question
guys.
there is actually asking us to give an example for each one, right?
Mm-hmm. So what structure is this called? This is the Achilles tendon. Okay. Your linea alba is going to be found in between your two rectus abdominis muscles. Okay. This is your Achilles tendon found in the base here. Okay, like 10 more seconds. Yeah, so this is going to be responsible for plantar flexion. Again, I'm happy you guys chose plantar flexion or dorsiflexion. Okay, because it means you guys know that it's associated with the foot, right? So think about it as like puppet strings. Okay, this muscle is your gastrocnemius. When it contracts, it's going to pull up on that back heel. Okay, we've actually already seen this question, just worded differently. I asked you guys in chapter 9, which muscle is responsible for plantar flexion? The answer is gastrocnemius. This is the gastrocnemius muscle. So, this muscle is going to be responsible for plantar flexion. Okay. So looking at the back of the calf, when you shorten that back of the calf, it pulls up on the back of the ankle and causes your toes to go downwards. You're looking at the front of the arm in this one. So 10 more seconds. And I did post that explanation in chat for that question.
Thank you.
Yeah, so this is going to be found the biceps brachii. Okay. Your biceps brachii is found in the front of your upper arm, triceps to the back of the upper arm. Okay. Hamstrings and quads, these are both going to be found in your thigh. Quadriceps in the front of your thigh, hamstrings in the back of your thigh. Okay, 10 more seconds. Yeah. So function of not a function of the skeletal system, production of digestive enzymes. Okay. That is going to be a function of your endocrine system as well as your digestive system. Okay. Both of those. Okay, 10 more seconds. Okay. So the muscle that antagonizes the movement of the quadriceps is going to be your hamstrings. Okay. So your quadriceps are going to be found on the front of your thigh, hamstrings on the back of the thigh. Okay. So this is another example of how we can ask a question without just showing you a picture, right? If you want to know like what muscle opposes the other one, just look at the one that's like opposite, right? So hamstrings are going to oppose your quadriceps. Okay. Triceps are going to oppose your biceps. On this one, I gave you guys a hint because I listed a whole bunch of muscles that were found in the leg to like, I don't know, repetition, use those ones. But hamstrings, when they contract, right, they're going to be pulling that knee back down, so causing knee flexion. When your quadriceps contract on the top of that leg, they're going to be pulling that knee out, so knee extension. Okay. When the quadriceps are activated, meaning when they are the prime mover and causing that knee extension, your hamstrings are going to be relaxed, right? And vice versa, when your hamstrings are contracting and pulling that knee back downwards, okay, your quadriceps are going to be relaxing. Okay, 10 more seconds. Yeah, so your zygomaticus muscle, okay? Your orbicularis oculi, again, going to be responsible for closing those eyes. Frontalis muscle, it's going to be found on your forehead, right? It's going to be responsible for raising and lowering your eyebrows. Masseter muscle, we talked about earlier. It's going to be involved in chewing. Okay, 10 more seconds. Yeah, so rhabdomyolysis, rapid breakdown of muscles and results in that tea-colored urine. DVT, deep vein thrombosis. That's going to be when you get like a blood clot in your leg. Okay. Compartment syndrome is when fluid starts building up in like a compartment of your body. And sarcopenia is like a progressive weakness that happens in older age. Okay, 10 more seconds. Yeah, so neo is going to be meaning new. Okay. Annotate. Dead, necro. So like necrophilia. Somebody's got a thing for dead people. All right. I don't know why, but that's what sticks with me. Crypto. So like cryptocurrency, hidden. Okay. Under, we've talked about a ton. Hypo. So like hypodermis, under the skin. Ten more seconds. Yeah. So ungo means nails. Okay. Oh, I forgot to look this up between classes because like I feel like I want to say it's Staphylo, but I feel like Staphylo is like no, it's definitely Staphylo because Staphylo means great. No. Staphylo is the cluster, Strepto is the chains. Okay. Anyways, okay. Dry, ZER or ZERO. Twisted chains. I believe it's Strepto. Okay. I can't remember off the top of my head if it's strepto or I can just Google it. I don't know what I'm doing. Yeah, so it's strepto. Staphylo is the grapes. Staphylo means clusters. So fun fact, little tangent. Staphylo actually comes from STAPH, which means grapes in like ancient Greek. So like it's clusters because it looks like clusters of grapes. So fun fact. But twisted change, strepto. You'll see this when you talk about different types of bacteria that cause infections. Wrinkles. I'm gonna butcher this. I believe it's RHYMID, Rymid or Rhymitid or something like that. Something along those lines. Okay. Okay, like 10 more seconds.
Professor, can I ask you a question?
Mhm.
So all of these from Pan Open that you had on the study sheet, these are different than what's on the study sheet. So should we know outside the study sheet, like all the prefix and suffix, or is it going to be what you're telling us to study on the study sheet?
Do what's on the study sheet. I just like quickly pulled some practice things from the units that you guys had. I didn't realize that they were like significantly different than what's on the study sheet because I didn't. So Dr. A is the one that writes like the study sheets for Pan Open.
Yeah, 'cause some of these are different. This is not what's on. Some of them are not on the study sheet, so that's why I was just saying, do we need? I want to make sure that we need to study outside that study sheet or just focus on the study sheet.
I believe you just focus on the study sheet. I'll take a look. But pretty sure the
There's no
study sheet.
pen over on there.
On
Where
the,
did
not
you-
on the packet. Here, I can show you guys.
Thank you.
Let me just close this really quick. But yeah, megaly is going to stand for enlarged. So something like cardiomegaly, you're talking about an enlarged heart. Okay. So if you go to evaluate, or wait, sorry, not evaluate. It's under content. Pan Open medical terminology. On each of the units, she has like a unit terminology study sheet. It's just like a doc X. So like prefix, brief definition, prefix, suffix, stuff like that, right? So osteocyte, prefix osteo, suffix site, prefix means bone, site means cell, brief definition, bone cell. Arthritis, we talked about that earlier, right? Arthro meaning joint, itis, inflammation. Arthritis is inflammation of your joints. Integumentary. Oh, I see. Okay. Yeah, I guess they didn't include these words. Like angio and whatnot. Donation and reflection. Yeah. So I would be also like familiar with like the conditions. So like there's a lot of conditions listed in like no, there's some conditions up here. Okay, good. We should be good. Yeah, I don't remember exactly what's on the Pan Open quiz, if I'm being entirely honest. But if I remember correctly, these terms are like pretty in line with what you guys are going to be quizzed on. So yeah. Again, all you got to do, go to content, medical terminology. Okay. You can see all the sections are laid out here. Under each unit, you have your study sheet here. Okay. And the study sheet will just take you to a Word doc, whatever loads. All right. But like we could also ask you about, oh yeah, so there are abbreviations on here. I see. I was gonna say we also ask about abbreviations. I didn't see like what does MRI stand for, but it does ask you like term magnetic resonance imaging, what is the abbreviation for that? Okay. Yeah, so SCC stands for squamous cell carcinoma, right? So streptococcus is a type of bacteria. Condyloid is a bone marking. Not a real thing. Small cell circles and small super cheeky children, just other distractors. Yeah, so something like this isn't like explicitly on your terminology sheet, but like this is something that's going to help you when we talk about joints, right? Ten more seconds. Yeah, so prefix syn is going to stand for together / joined, right? So arthro means joint, syn, arthroses are fixed, aka joined, aka together, joints. That makes sense. Okay, so that kind of helps you out if you're trying to remember what a synarthrosis is. Okay. Yeah, so tendonitis, inflammation of the tendon. Okay. And that's all I have for you guys. Like I said, we like went right up to the buzzer. If you guys have questions, you can email me. Please don't wait until Sunday to start studying. If you email me Sunday night at 11:59, I'm probably not going to answer, you know? So, and also don't wait until Monday morning to start studying. So, but I have noticed that this semester, it seems like everybody's been studying like not last minute. It's, I mean, from what I can tell. So, props to you guys. All right, I will see you on Monday. I believe your guys' exam starts at 4:30. Double check that schedule that got sent out, and I'm gonna copy and paste it in that email tonight too. So, have a good rest of your weekend, guys.
Thank you. Good night.